Welcome to the all viewers and well wishers of the world. The purpose of my lecture is learn the knowledge from the word, return the knowledge to the word. Motto of my life is learn, earn, and return. I have learned a lot, earned a lot, now to return a lot to the word. The topic of today is lipoma. Lipoma is a slow growing benign tumor made up of fat tissue. It is situated between skin and underlying muscle layer, but it may go deeper. Soft to touch, feels duffy, painless, moves readily with slight finger pressure. They occur just under the skin, but again, they can be deeper and go deeper. Mostly less than 5 centimeter, 2 inch in the size. Common locations are upper back, shoulders, arms, and abdomen. Here one can see the lipoma on the chest wall and here on the leg, and as you see, it is just the pushing of the adipose tissue through the muscle and also just pushing the skin upward and giving this appearance of lipoma. One may have many lipomas. Cause is unclear, but risk factors include family history, obesity, and the lack of exercise. They people are more prone to have lipoma. Diagnosis is by physical examination, medical imaging, or tissue biopsy to confirm the diagnosis and to rule out any cancer or the cancerous growth transformation. Treatment is observation or surgical removal. Rarely they recur following removal, so do repeat surgery to get rid of these. Here one can see the lipoma. It is basically the collection of the fat tissue and the skin overlying, and it is having a fibrous capsule and enclosed in capsule, and deeper here is the muscle layer, and here that it presents like this, and the lipoma is just looking like this, but actually on cut section it gives you this much information about that. Epidemiology, the term lipoma was first used in 1709. Most common non-cancerous soft tissue tumor. 2% of the general population has a lipoma. It can occur any age, but mostly in the middle age, in 40 to 60 years of age. Male are more affected than female, perhaps because they consume more fat and they have more fatty tissue, and that can be one of the reasons. Cutaneous lipomas are rare in children, but it has been seen only in inherited disease, that is Benayan-Zonana syndrome. Lipomas are small, 1 to 3 centimeter, but can change to giant lipoma after many years to 10 to 20 centimeter in size, and they can weigh up to 4 to 5 kg. Here, that is Benayan-Zonana syndrome, where one can see the different lipoma and the different body tissues, and also one that is on the forehead. So this is a rare disease called Benayan-Zonana syndrome. Other animals, they do also have the tendency of lipoma. They can occur in older dogs. Overweight female dogs are prone to develop these tumors. Then lipoma can occur in trunk or the upper limbs of the dogs, also found in cattle and horses, cats and pigs. A pedunculated lipoma can cause entrapment and torsion of the intestine in the horses, and that causes necrosis, colic, and possibly one of the death cause of horses. Here one can see the distribution of white adipose tissue and distribution of brown adipose tissue. There are two types of the tissues, and white adipose and brown. Here, in case of the white adipose tissue, it is seen in pericardium region, pericardial sac, subcutaneous or mental tissues, and then it is perirenal tissues, retroperitoneal, mesenteric, and subcutaneous. These are all composed of white adipose tissue. And here, the brown adipose tissue, it is seen in the glands of the neck, then supraclavicular glands, para-aortic lymph nodes, mostly seen in the lymph nodes which are situated at neck, supraclavicular, para-aortic, then paravertebral lymph nodes, then suprarenal lymph nodes, and the other lymph nodes, they are mostly composed of brown adipose tissue. It is said to by a very successful man, Dr. Abdul Kalam, who was President of India, if you fail, never give up, because he thinks and he says fail means first attempt in learning. End is not the end. In fact, end it means effort never dies. And if you get no as an answer, remember no means next opportunity. So be positive always, even if your blood group is B negative. Now the types of the lipoma, mainly these are of two types. These are superficial and deep, depending upon their situation, lying superficially or deep. But there are many subtypes of the lipoma. Number one is superficial subcutaneous lipoma. These are the most common types of the lipoma seen, and they lie just below the skin, mostly on the trunk, thigh, and forearm. May be found anywhere in the body where fat is present. Number two is spindle cell lipoma. These are asymptomatic, slow-growing subcutaneous tumors, and mostly on the posterior back, neck, and shoulders of the older men. They are having the spindle cell lipoma. Then pleomorphic lipomas, like spindle cell lipomas, they are present on the backs and the neck of the elderly man, and they are characterized by the floret giant cells with overlapping nuclei. That is the characteristic of this pleomorphic lipoma. And here one can see the superficial subcutaneous lipoma, which is very commonly seen. Then spindle cell lipoma, as you can see coming out from the cheek, and when it has been removed, it look like this. So that is called spindle cell lipoma. Other types of the lipomas are intradermal spindle cell lipoma, as the name is, mostly affect women with the white distribution present on the head and neck, trunk, and upper and lower extremities. Then the other type of lipoma, fifth type, is angiolipoma. They are very painful subcutaneous nodules having all other features of a typical lipoma, but because contain angio, the blood vessel, so they are painful. Then angiolipoleomyoma, as the name is self-explanatory, angio, blood vessel, lipo, lipid, or fat cells, leo, smooth muscle cells, myoma, are acquired, solitary, asymptomatic acral nodules. They are characterized histologically by well-circumscribed subcutaneous tumors. These are composed of smooth muscle cells, blood vessels, connective tissue, and the fat. So the name is angiolipoleomyomas. Here one can see the pleomorphic lipomas, the large lipoma found on the back, on the neck, and intradermal spindle cell lipoma, as one can see behind the neck, the large lipoma, and this is also one on the foot, as one can see that is having spindle shape, and that is the huge lipoma on the foot. Angiolipoma, as I have told you, these are having the blood vessels, and one can see the blood vessel, and these are very much painful. Again, one can appreciate some blood vessel because these lipomas are composed of blood vessels and the fatty tissue. Then angiolipoleomyomas, as one can see the structure of that, which contains smooth muscle, contain fat tissue and the connective tissue, so that all make the angiolipoleomyoma. The next type is chondroid lipoma. These are deep-seated, firm, yellow tumors occur on the legs of the woman. The eighth is hibernoma. These are the lipomas of the brown fat. I have already told you the distribution of the white and the brown fat in the body. The ninth type is adenolipomas. These are the lipomas associated with the eccrine sweat gland. So the name is adeno. Adeno means glands involvement. Neural fibrolipomas are overgrowth of the fibrofatty tissue along a nerve trunk. So the name is neurofibrolipomas. It causes nerve compression, and the results of the nerve compression, these are seen in people having neural fibrolipoma. Then fibrolipoma is a lipoma with a large amount of the fibrous tissue in it, so that's called fibrolipoma. Here one can see the chondroid lipoma, and when it is removed, it looks like this. Similarly, the hibernomas, these are removed and giving the appearance like this. Then adenolipoma, as it is having the glandular tissue, one can appreciate that. Neural fibrolipomas, these are seen here, and fibrolipoma, that is pedunculated, seen on the leg, and that is the large with containing lot of fibrous tissue. The 12th type is sclerotic lipoma, is mostly fibrous lesion with the focal area of the fat, and the 13th type is cerebellar pontine angle and internal auditory canal lipoma. As the name is, their situation is, as the name is, cerebellar pontine and internal auditory canal. The 14th type is corpus callosum lipoma, is a rare congenital brain condition, may or may not present with symptom. As the name is, it is seen, it occurs in corpus callosum or the callosal commissure, which is a wide flat bundle of the neural fibers beneath cortex in a human brain. And one can see on the MRI, and that is the cerebellar pontine angle and internal auditory canal lipomas, as one can see here. And here corpus callosum lipoma, that one can see at the corpus callosum, and here again one can appreciate the corpus callosum lipomas.